Yes? Is that a yes? Okay. Hi, my name is Nancy, and I'm the Medical Services Manager of Janus of Santa Cruz, and I'm here to give you guys a training on Naloxone, okay, which is the opiate reversal medication. And what we're going to do today is just run through these slides. Once you have gone through this training, you can come to my table, which is kind of out on the right here, over here, and fill out a little registration form, which takes about 30 seconds, and you can walk away with a kit. Okay, we just have to have you sign the registration form so we know that you had the training. Okay, so we operate the SCOPE program, which is the Overdose Prevention and Education Program of Santa Cruz. How am I going to advance these slides here?
Just still our next slide.
Okay.
You don't have a...
Next slide. Okay, so drug overdose is now the leading cause of accidental death in the United States. It surpassed motor vehicle accidents in 2013, and over 50,000 deaths in 2015. 45% involved prescription opiates. So a lot of people, when they think of opioid overdose, they think of heroin, but there's an awful lot going on with prescription medications these days also. In 2015, there were 49 overdose deaths in Santa Cruz County. That number dropped last year, gratefully. But I just kind of wanted to show you, because I have this data here, what those overdose deaths look like. So only 15% of those were heroin related entirely. 22% were mixed medications, and another 22% were just straight prescription opiates. So this is data from the Centers of Disease Control that kind of looks at where the prescription pain relievers are coming from that people are overdosing on. And I think a lot of people just automatically think that they were bought off the street or they were sold to somebody illicitly, but actually 55% of those that people overdosed on were given to them by a friend or relative out of somebody's medicine cabinet. Only 17% of those were actually prescribed to that patient. Okay, so this is the Safe RX event here, and I just wanted to go over quickly what the three areas of focus of this coalition are. The coalition was developed around the opiate overdose awareness that's going on around the country, and there's three areas that we're trying to tackle in the RX coalition. The first one is safe prescribing methods, meaning that we want to try to help providers hopefully make more informed decisions about whether or not they should even be prescribing an opiate, how much they should be prescribing, and how often they should prescribe. In addition to that, we also want to talk to folks in the home about getting rid of their medications when they're no longer needed. So not have them sitting around in a medicine cabinet and getting rid of them so that somebody else doesn't use them inadvertently. The second area of focus is to increase medication-assisted treatment for people that have substance use disorder or opioid use disorder, using methadone and buprenorphine, which is Suboxone, and also Vivitrol, and also increasing the use of Naloxone. So what are opiates? Opiates are substances that come from the poppy. There's only two of them that actually come from the poppy, and that is morphine and codeine. And the rest of the ones in the box here, except for two, are synthetically derived from one of those two compounds. So ultimately they came from the poppy. The effects of opiates you can see over here on the left. They were prescribed mostly for pain relief and cough suppression. Codeine's a cough suppression. But what happens in an overdose situation is there's sedation and respiratory depression. What that means is that opiates, they'll bind to the receptors in your brain that control breathing and slow it down and eventually stop it if you take too much. So these are just a couple pictures of some opiates. We're just going to kind of quickly go through them. There's codeine on the bottom. Obviously there's Percocet, OxyContin, heroin, Loratabs, Vicodin, Cadian, Roxicodone, Dilaudid, fentanyl, Opana, Norco, MS-Contin. So what's an opiate overdose? It's obviously a toxic amount of an opiate with or without other substances like perhaps benzodiazepines or alcohol. And what happens is, like I said before, opiates attach to the receptors in your brain that control breathing and slow it down and eventually stop it if you've taken too much, and that causes the heart to stop. Unconsciousness, coma, and death, and even if people are revived, sometimes long-term brain damage. So this is my little cartoon of a cell. The orange down there is the cell, and the opiate receptor is sticking up out of the cell and grabbing onto the opiates that are floating by in the bloodstream. Okay, so naloxone is a very strong binder on the receptor, and it knocks all the other opiates off and takes its place. However, it doesn't have any effect on the receptor. It's called an antagonist, and that means that it just allows the effects of the opiate to reverse and allows people to start breathing again. So what are the risks for an opiate overdose? A change in tolerance. This is a big one. So people that have become used to taking an opiate every day, it no longer has much of an effect on them if they take that same amount every day, but they developed a dependence on it, so their bodies are really accustomed to that amount. And if they stop taking it or they slowly taper off, their tolerance changes, and they can go back down to baseline where they have no tolerance anymore. And what happens is when people maybe enter a rehab situation, maybe they've lost a prescriber, and they no longer have opiates accessible to them, or they've recently come out of jail, they're uncomfortable, and then if they're presented with an opiate, they try to use what they did before, and they generally will overdose, hopefully not fatally. But it's a big reason why people do overdose. Mixing drugs, particularly ones that are sedating, like benzos and alcohol. Quality and potency, not all opiates obviously are the same strength, so they're not interchangeable. If people's physical health is poor, if they're taking something by mouth and they start smoking it or injecting it and using alone, which is most commonly when people fatally overdose. So I'm just going to concentrate on what's in the box here. What are the signs and symptoms of an overdose? Overly sedated, meaning you've taken too much, but you haven't completely overdosed yet. Your muscles are really relaxed, your speech is slurred, you look sleepy, you nod, meaning that people kind of fall asleep and keep bouncing back awake, but they will respond to a stimulation like shaking them or giving a pain stimulus. In an overdose situation, they, instead of breathing normally, they might be gurgling or snoring. Their skin looks really pale, sometimes sweaty. If they're becoming hypoxic, their nail beds and their lips start to get blue or gray. Their breathing slows down significantly, or they stop breathing altogether. And they have a heavy nod that's not responsive when they're stimulated. So these are the steps in responding to an OD. Yes?
It mentioned a sternal rub.
I'm going to talk about that.
Okay.
Yeah, so these are the steps, and I'm going to go over them one by one. Okay? So what you're going to do if you see somebody that is down and out, you're going to ask them if they're okay. You're going to try to stimulate them, and you're going to give them a pain stimulus if they're not coming around. And if they don't respond to that, I'm going to talk about that on the next slide. You're going to give them, check their airway and give them a couple of rescue breaths. We're not asking that you know how to use CPR, but the first thing that happens in an overdose situation is people aren't breathing normally. They might be getting a little hypoxic, which is low oxygen to the brain, or they might not be breathing at all. So we need to help them. The next thing we do is administer naloxone. We call 911 and we continue rescue breathing. And if we get no response in 2 to 3 minutes, we give them, these are the doses here. I'll talk about those in a minute. We give them a second, there's 2 doses in each vial, in each kit. Okay, so you give them another dose. Okay, so a sternal rub. A sternal rub is what we suggest giving to somebody to find out whether they'll respond to pain. And if you take your fist and you use the flat portion of your fist and you rub it against the sternum as hard as you can, it's pretty painful. If people will respond to that, they're not completely overdosed, but you're not causing any tissue damage by doing that, like pinching or slapping people or other means that people try to get people to come around. Keep going. Nope, other way. Okay, so somebody, back up one more time. Go forward. Go forward. There's a slide missing in here. Okay, the slide that's missing is showing you what to do to give people rescue breaths. So all you need to do is you need to tilt their head back. You put your mouth over their mouth. If you don't want to do that because you don't know this person, if you can breathe through your shirt or their shirt and you can put it up over their mouth, you can use that as a barrier. Pinch their nose. If you don't pinch their nose, when you put breath in, it'll come right back out their nose. So all you have to remember is pinch the nose, put your mouth on their mouth. You should be able to see their chest pop up and down if you're doing it right. And just give them 1 or 2 to get going. And then you're going to administer naloxone. So in this kit here are 2 doses of naloxone, and they're in this little bag. The reason they're in this little bag is because they're sensitive to light, and they're protected in this bag, but they're also protected in the container, okay? This is what they look like, and when you get your kit, you can just take it apart and take a look at it. It looks like there's only about 1/3 of the volume in here that's full, but this is a single dose. So what you're going to do is there's an orange cap on here. You're going to flip the cap off, and there's a little rubber septum in here, and there's syringes in here. You're going to pull the entire contents of one of these into a syringe. I know it's kind of scary if you've never dealt with a syringe before, but believe me, I have plenty of people that have come to me that have never touched one of these in their life, and they've saved a life doing this. I mean, usually people they'll be completely unconscious, so that you don't have to kind of be super afraid of hurting somebody. If you happen to, people say, well, what if I hit a vein, or what if I hit the bone? It doesn't matter. All you need to do is get this in them, and we suggest you putting it either in the arm, in the thigh, or in the butt, okay? You want to put it straight in. If you have pulled a bunch of air into the syringe, just turn it upside down and squirt it out. But as soon as you can, just get that into them. Just go straight in. Don't worry about how fast, how slow, whatever. Just boom, do it. There's alcohol wipes in here that you can use to clean skin, but we don't even suggest doing that. You can go right through the clothes. If somebody's got a jacket on, just go right through, do the pants, because you're going to get through the pants rather than a heavy jacket. Okay. And like I said, keep going. Like I said, there's 2 doses in here, so after you've done the first dose, if somebody doesn't come around in 2 to 3 minutes and you're still doing rescue breaths, give them the second dose. However, hopefully you will have called 911 and somebody will have come there by then and taken over for you, okay? The wake up, people generally don't react violently to having naloxone, but they're not happy. If they've developed a habit, a dependency, they'll start to feel withdrawal, okay? They'll also be really confused because the last thing that they remember was they fell asleep using, and now they wake up, and if they haven't used a bunch of other sedating substances, I mean, they wake up. All of a sudden they're awake and confused because there's all these people around them. So just kind of try to calm them down, reassure them, and try to make sure they don't use any more drugs. So naloxone only acts for about an hour. It's very short acting. And not only does it have a really rapid onset in 2 to 3 minutes, it only lasts for about an hour. So what you can tell people when they start to feel uncomfortable is that just hang in there. After an hour, you're going to feel better because it's going to wear off. But the other thing to keep in mind is that if somebody has taken a long-acting opiate, methadone is the longest acting one, but hydrocodone, like Vicodin, that's also long-acting. In an hour, they might not have metabolized enough of the drug for them to be safe, and they might overdose again when this wears off. So if you haven't had 911 come around, you should really hang out with them and make sure they're not going to overdose again. Hopefully 911 has responded, but you might have to give another one of these if they overdose again. So this is the kit. This is also a sharps container. So if you use this, just go ahead and put the needles back in here and bring it back to us at Janus. We'll give you another kit. And there's two vials of naloxone in the little bag. There's 2 syringes, there's 2 alcohol wipes, there's some instructions if you forget how to use it. Keep going. Like I said, it's short acting. It depends on the metabolism, how well your liver is working and what have you. But it only acts on the opiate component of a multi-drug overdose. So if somebody has overdosed on benzos or alcohol, they're not going to come around all the way, but they will start breathing again, which is the most important thing. The great thing about this too is that if there's no opiates present, it does nothing. So if you're concerned that you don't know whether it's an opiate overdose, say somebody is just out and you don't know whether it's alcohol or opiates, whatever, you can just give this to them, you're not going to hurt them. You may not help them, but you're not going to hurt them. So, I mean, I don't have an opiate dependency, so somebody could give this to me right now, I wouldn't even know that I had gotten it. It's stable for 2 years, and so don't put it in the refrigerator. It likes room temperature. It's okay in under the seat of your car, generally. Maybe probably not in the glove compartment. Yeah, I think I went over all this. And another thing to keep in mind is that it's prescribed by Dr. Morris, who's going to be giving a talk pretty soon. So it is a prescription medication, but it's not prescribed for you to give to yourself. It's in this particular, it's called a standing order. It's prescribed for you to give to anybody in the community that you think is overdosing. And there's additional liability protection in California, Good Samaritan laws that are specially for naloxone, so that you can't be sued for being a Good Samaritan and, I guess, practicing without a medical license, giving this to somebody. And I think that might be all I have. A little bit more on the California law. So it permits individuals to possess and administer naloxone in an emergency and protects them from civil or criminal prosecution for practicing without a medical license. Okay, so it's the same like if you tried to help somebody in the street in a car accident and you did your best, they couldn't sue you for doing that. Okay? And that, I think, is the end. Yeah, that's all I have to say. So, I thank you. So if you guys would like a kit, yeah, and go ahead. Questions?
Can you give this to someone who's overly sedated, not like unconscious yet?
I got to ask that question, and I wouldn't, but I wouldn't want to leave that person alone either. So I would check on that person. If that person, if it starts to progress, and now they're unconscious and they're not coming around, then give it. You also don't want to give a medication to somebody if they're actually conscious and they can object, because then you're giving them something that they haven't given consent for. When they're unconscious, it's implied consent, if that makes sense. But yeah, I mean, as long as they come around, just kind of leave them be, but they need to be checked on.
Is there any way that, for lack of a better term that I can think of, any way you can mess this up? That, anything that you can do that's really wrong with this?
I don't think so. I can't really think of anything. No. Like I said, it doesn't matter. I mean, this medication is meant to go into any tissue, and it's actually in a hospital setting. It's given intravenously. So if you hit a vein, you're fine. If you hit bone, I mean, they'll never know. You're not going to hurt them. So no, not really. And like I said, it's a very safe medication. The safety profile is really great. It's very rare for anybody to be allergic to it. It's one of the safest medications out there, actually. So people give it to children when they've overdosed.
So if someone is in that, still conscious but overly sedated,
right?
Would you, if you were actively working with them, could you, through stimulation or breathing, could you keep them from going into that unconscious state?
No. The only thing that'll help is if that overdose is going to happen, there's nothing you can do to prevent it. This is the only thing you can do to turn it around, and give them oxygen also.
Nancy, could it take a little longer to work on some folks?
So it depends on how much they've used, the strength of what they've used. Some of the heroin that's going around is laced with fentanyl, and that's a really, really powerful opiate. Some people have said they've needed to use at least 2 of these for some really heavy overdoses like that. And that's why we suggest you call 911 as soon as possible and let somebody else take this person off your hands. Okay, but I mean, these doses are pretty mild. They don't put people in serious withdrawal. But you know, if an EMT came around, they would continue to give it to them over and over and over again. So.
How many doses are in the kit?
2.
And can you hold up like each individual component and
Sure.
what it is?
This is the kit, obviously. And inside the kit is the naloxone in this little baggie. Instructions, 2 needles, alcohol wipes. It's pretty simple. But like I said, you can, you know, when you get your kit, you can just go ahead and take it apart and put it back together. So you can see all the components in here, so you're comfortable with what they are, what they look like.
And there's 2 bottles of naloxone in that little thing, right?
Yes. Yes. Okay.
How many milligrams of each?
0.4. 0.4. Yeah.
If somebody doesn't respond with the 2 vials.
Well, so if somebody doesn't respond with the 2 vials, I mean, hopefully you've called 911 and somebody else is coming along. You know, maybe somebody's got another kit. If you have more, just keep giving it. You know, but most people do respond. We give out a lot of these kits. We have a lot of people in town that take these kits over and over again for obvious reasons. And about 15% of our kits are actually used because we collect data when people come back and ask for refills.
Who should have one of these kits?
I think anybody that knows an opiate user should have one. I think anybody that believes they could encounter an opiate user. I mean, there's no reason, even if you didn't know an opiate user, and I don't mean necessarily using illicitly. I mean, just think about, you know, somebody's little grandmother who is prescribed opiate pain medication that she takes regularly, and she might take it completely as prescribed. She might also be taking benzos completely as prescribed. And then comes the day where she's taken her medication and she forgets that she took it. So she takes it again. And then maybe she has a glass of wine. That's all it can take sometimes for people that are debilitated, that might be sick. I mean, this happens. So I say that, you know, if you at all think you might encounter anybody that you know that you could use this on, just go ahead and take one.
Is there an expiration date on it?
Yeah, they're good for 2 years, and the expiration date, good question, is on the vial. Okay, a little hard to read, but if you pull it apart, you'll see it there. Okay, and if they expire, just bring them back to Janus. We'll give you new ones. Are we good? Okay, so if you'd like a kit, come to my little table and fill out a form, and then you take a kit with you.
Other than this event today, how else can people get the kits?
Well, we give a lot of community events, but they can go to any Janus site and get a kit. Okay?
Thank you.
Thank you.